Welcome, everybody. We're going to wait a few minutes to let people join in. We've got lots of people joining already. Very excited to have you here today. Good morning. If you're just joining us, we're just giving people a chance to sign on, and then we'll go ahead and get started. We have a great day planned for you. Okay, we're going to go ahead and get started. The numbers are slowing down a bit. So good morning, everyone, and welcome to the NAMI New Hampshire Annual Conference. Hope brings us together. Thank you for joining us. If you're new to NAMI New Hampshire, we are so glad you're here. If you're a longtime member of the NAMI New Hampshire family, thank you for coming back. NAMI New Hampshire is a grassroots organization that provides support, education, and advocacy to individuals and their families impacted by mental illness and suicide here in the Granite State. We do this by offering a variety of programs and events, including today's conference. We will give everyone a chance to get logged in, and then we're going to continue to begin. It's a beautiful day here today. So if you're joining us from the office, at home, maybe outside, we really appreciate you. So this year's conference theme, as I said, is Hope Brings Us Together. And at a recent volunteer and donor and supporter appreciation event, we asked some folks to share what is bringing them hope. We have shared a couple of these already in the Whova app, but here's one from our friend Mo, which we thought would be a great way to start the day. Oh, sorry, it's doing a weird thing on my screen here.
Hi, my name is Mo. I have done a few things with NAMI, actually. Hi, my name is Mo for the CIT program, I have done a few things with NAMI, actually. I've been a volunteer for the CIT program, which is one of my favorites. I've also attended a few of their webinars. I have raised money through events, and I'm in full support of everything that NAMI does because folks like me, folks like you, need them. What gives me hope is knowing that you are here listening to me, because I've spent a lifetime with no one listening. So thank you for listening.
And thank you, Mo. I hope she's here listening to us today because we're so appreciative of Mo and all of our volunteers and supporters. If you would like to share what's giving you hope, please feel free to comment in the Whova app. So I'll finally introduce myself now that I've been talking for a while. My name is Michelle Watson, and I'm the Volunteer Engagement Supervisor here at NAMI New Hampshire, and I coordinate this conference with Kimberly Samariba, who's been so amazing and so helpful. You will see us throughout the day today and in the Whova platform. We are here to help and would love to connect with you in the discussion boards, which have been very, very active this year. We also have an amazing committee of staff and volunteers whom we wanted to recognize for all the valuable contributions to this conference today. If you're interested in being a part of next year's conference, please do not hesitate to reach out to us. You can fill out the volunteer application on the NAMI New Hampshire website. We welcome new members. If you run into any technical difficulties today and need some support, we have help. Reach out to Emily Huff at the number on your screen. Today's presentations are in Zoom webinar, and there will not be an option for you to turn on your camera or your microphones. We welcome questions in the Q&A, and we'll do our best to get to them all. This morning's welcome and keynote sessions are going to be back-to-back right here, and they are accessible through the same link that you use to get to to us right now if for some reason you get kicked off. We'd like to express our thanks to our sponsors who have helped make today's conference available and free of charge. So now I'd like to introduce NAMI New Hampshire's Executive Director, Susan Stearns, to say a few words and to welcome New Hampshire's Department of Health and Human Services Commissioner, Lori Weaver.
Thank you, Michelle. Good morning, everyone. It's so wonderful to be able to be with you on this beautiful morning. I'm sorry we're not in person, but really thrilled to be able to welcome you to our annual conference and kick us off this morning. Thank you for once again joining us. We had, I think, over 270 folks registered, and a number of you made donations to help support the conference and the work here at NAMI New Hampshire. We're so incredibly grateful to you, our NAMI New Hampshire family. Michelle mentioned we have a number of great sponsors who help make sure that this event remains accessible and free so that anyone can join, starting off with our education sponsor, Janssen. Our supporter sponsors include AmeriHealth Caritas New Hampshire, Carillon Behavioral Health, HCA Healthcare, comprised of Frisbee Memorial Hospital, Parkland Medical Center, and Portsmouth Regional Hospitals here in New Hampshire, Moms Rising, and the New Hampshire Community Behavioral Health Association. We are so grateful to you all for your partnership. I've also been asked to mention that NAMI New Hampshire is once again a finalist for a Red Sox Impact Award this year. First prize is a $10,000 grant from the Red Sox Foundation, and you can help us become number one by voting for NAMI New Hampshire every day. You can do once a day per email address and until the end of the month. And if you go to redsox.com/impact, I think someone's dropping that in the chat here, you can vote every day, just one time per email address. So would be thrilled if you would vote for us, and we would be able to achieve that first place and bring that award back home to New Hampshire. So, you know, in the past year, we have seen increased awareness and openness. It continues to grow, this willingness to talk about issues of mental illness, suicide, substance misuse disorder, and really bring those issues out of the shadows and into the light. We particularly notice that our young people are true leaders in this effort. I had the distinct pleasure of getting to meet with a group of some of our Connect youth leaders on Monday at Bedford High School. And I tell you, our future is bright when we look at these young people and their advocacy on these issues. Here at NAMI New Hampshire, we continue to see increased need and numbers of folks seeking to access our core programs, from our support groups to our family-to-family, peer-to-peer, NAMI Basics, our Connect Suicide Prevention and Postvention program, our side-by-side educational program. Our crisis intervention team training for first responders, that gold standard practice, continues to grow with support across the state. And we're incredibly grateful to our partners at Police Standards and Training Council and the New Hampshire National Guard, who often offers their facility. We actually have a CIT training happening this week. So a number of our folks will be having to watch this conference on the recording because they are committed for a full week of training with our first responders. We've seen the new initiative of the NAMI Ending the Silence program come here to New Hampshire to provide opportunities for speakers and to engage with middle and high schoolers. We're just so excited. On the advocacy round, we have entered year 10 of the emergency department psychiatric boarding issue here in New Hampshire. Yesterday, we had 33 adults and 16 kiddos waiting for a bed. I am pleased to be able to report that the state has made significant investments in the 10-year mental health plan, and there is a broad array of partners and policymakers who are working dedicatedly. And we're going to hear from Interim Commissioner Weaver today about some of those efforts and others happening at the Department of Health and Human Services. in order to ensure that we have the robust array of community-based care and access to that care that folks need to avoid needing an inpatient psychiatric admission, and also to ensure people have access to the supported living arrangements they need upon discharge to be successful and live full lives in their communities. I want to thank all of you. I know many of you follow our public policy alerts that come out every Friday during the legislative session, and it has been a busy one. And I also see how many of you submit testimony, sign in support or opposition of bills along the lines of our legislative priorities. Truly grateful to you and for sharing your personal and deeply personal stories to try and educate our legislators and help them understand how important these issues are. We attended a press conference yesterday for the reauthorization of Medicaid expansion, a high priority, as is emergency behavioral health services, Medicaid coverage for new moms postpartum for up to a year, and increasing Medicaid reimbursement rates so that we can ensure that our providers are adequately compensated and that we can make sure that New Hampshire attracts the very best talent so our loved ones have the very best care. We've greatly appreciated your help because we've had to work on a number of beds that would have bills that would have potentially negative impacts on our youth, especially our LGBTQ youth and their mental health. So thank you for that. We're so grateful to you. And finally, I do want to acknowledge that these last several years and even particularly in recent months here at NAMI New Hampshire, we've had folks who have had profound losses in their lives. And we know that heartache is a part of life and a part of the journey sometimes for us. And here at NAMI New Hampshire, please know that we carry you in our hearts. And when it gets hard to hold on to hope, we're here to hold on to that hope for you. We will get through this together. I have absolute faith in our NAMI New Hampshire family, in your resilience and your ability to share love and hope. So it is my great pleasure to now introduce Interim Commissioner Lori Weaver for the Department of Health and Human Services. Lori Weaver currently serves in that role, having come to it with more than 25 years of experience at the department and a strong focus of working collaboratively across all levels with other state agencies and external partners. Commissioner Weaver has demonstrated leadership and success in achieving shared organizational goals and objectives. Prior to assuming her current role, she served as Deputy Commissioner of the department, so she has a great deal of knowledge she brings to that role and has been able to really ensure continuity of operations throughout the last several years of the pandemic. She had previously been the Associate Commissioner of Operations at the department, overseeing the operational aspects of its largest department. During her tenure there, she has served as Director of Organizational Development Services and Director of Training Services. She initially worked for 10 years as the Training Administrator for the Division of Children, Youth, and Families. And prior to working with the department, she also worked for several nonprofit agencies and served as Director of Residential Services for Children and Youth in both New Hampshire and Massachusetts. Commissioner Weaver is a graduate of the University of New Hampshire with a bachelor's in psychology and has her master's degree in human service administration from Antioch University. She has received a certificate of organizational development from Antioch and achieved 64 credits towards her master's of counseling. She lives locally with her husband and 2 boys. I do want to say that within a month of taking on this role, Commissioner Weaver and her team laid out a new roadmap for the department, including a commitment to promote thriving communities with an initiative to increase access to services in the behavioral health continuum. So welcome, Commissioner Weaver. We're so looking forward to hearing from you today.
Thank you, Susan. That was a great introduction. Thank you. Good morning. I was really excited when I was asked earlier this year to be a part of the NAMI New Hampshire conference. I will be honest with you. I am, Susan mentioned, I am a trainer, is in my bones. I've done it for a really long time. So the technology was not around when I first started training. So it's a little odd for me to talk to 270 people and only see maybe 2. So I'll just, I hope that you can bear with me as we get through that today. But I'm really excited to be here. So welcome to the conference. I was looking at the conference brochure earlier this week, and the sessions are so timely and so relevant. I know it's going to generate a rich and fruitful dialogue throughout the day. And I really also like how you have it structured, that you're not too long on one topic so that people can stay engaged, which is always a challenge with online conferences. So I hope you all make the most of today, make new connections, meet new people, learn new things, and share. Although, as Susan said, I'm not new to the department. I am new to the role of commissioner, 6 months, but who's really counting? Probably me. I am counting. It was 6 months last week. As Susan mentioned, I've been with the department for a significant portion of my 34-year career in human services. Prior to the state, I did work in the nonprofit world running residential programs for children and youth with mental illness in both Massachusetts and New Hampshire. And I actually even went to graduate school to become a therapist. And my biggest lesson learned there are many different ways to make a difference in human services, and being a therapist was not for me. However, it gave me a great appreciation for those that do this most important and critical work. That is the explanation of almost a full degree, a master's degree in counseling. So I've always had an interest in the human services field for as long as I can remember. So I ultimately shifted my focus from clinical to administration and systems. However, I will tell you, my clinical skill sets, I use them every day along with my other skill sets. As many of you know, the department and NAMI New Hampshire have been partners for many years. I speak for all in the department when I say that we are honored to partner with an organization that works tirelessly to build community, inspire hope, and create important resource connections for people in need. NAMI's stated vision of a future where people affected by mental illness have hope, health, and help is a vision that DHHS fully supports and believes in. As the state navigated the 10-year mental health plan, NAMI New Hampshire worked right alongside us. Together through NAMI New Hampshire advocacy and partnerships, we have made strides in mental health, substance use, and suicide prevention efforts. Working together with community members, other state agencies, nonprofits, and health and social service systems, we've created a vision for New Hampshire that serves all people with behavioral health needs, when and where they need it. Not surprisingly, as we move forward, there's challenges that remain. There's challenges at the front end of services. There's challenges at the back end of services. There's challenges with resources and systems coordination. We are all too familiar with the challenge of a lack of resources, staffing to open up more beds, staffing for community mental health centers, staffing for crisis response teams, transitional housing, the list goes on. Then there is the additional challenge of striking the balance of creating the right amount of and the right type of resources. Over the last year and a half, the department's been focused on finding ways to strike that balance. And I wanted to share with you today a high-level summary of some things that we've been working on. As you know, the department is huge and there's a lot here that we do. So it was really hard for me to keep this. Susan said I only have like 10 minutes. So I'm trying to keep it down and narrow it down. And many of you are going to be familiar with this work, but I just wanted to go over, I clumped it out into 3 major categories, really progress in inpatient or / residential care, community care, and some systems improvement. Believe it or not, next month will be a year that the state purchased Hampstead Hospital. So we are getting ready to celebrate that milestone, as well as another milestone. In 2 weeks, we will open our first psychiatric residential treatment facility at Hampstead. So that is a humongous accomplishment, and that's the first of its kind in New Hampshire. And we were able to do that within even the first year of the contract. So you keep your eye out, you'll see some press on that coming up in the next 2 weeks. Solution Health. Some of many of you have heard about our state's investment in Solution Health, and part of our rationale there is really investing in that money to be able to, for that bill, to be able to get something back. And what are we getting back? What is the state getting back? we are getting guarantees that New Hampshire residents will take precedence and will get services. We are taking, getting back that certain percentage of that population will be those of our most vulnerable, a lot of our Medicaid population, and a guarantee of services for 10 years. So we're in it for the long haul here to be able to stand up some systems and get something back. It's going to serve adults and children. And it's not only going to create just beds. We hear people talk all the time, we need beds, right? Just designated receiving facility beds, but it's going to create services, inpatient and outpatient service. So it's not a one-stop that you go in for a DRF and then you're discharged. You are able to continue care and get the care that you need. Substance use disorder, mental health, specialty services. We are looking and had made some asks for some eating disorder services and some developmental disability services as well. So we are very excited about that. We are working hand in hand with Solution Health right now as we speak on shovel ready, getting ready to build, as well as programming, staffing, PR, all of that, the state will be working together. And that's looking right now, there's a tight time frame for that to open up at the end of 2025. And that does feel like a long time away, but it does take a while to build a hospital. Speaking of hospitals, Forensic Hospital, this is, Susan has been, and Ken, before you have been instrumental in helping the department with the community here in Concord with the build of the Forensic Hospital. We have battled stigma significantly, just even talking about this for years. And we are actually at a point where you're going to see a contract go through for the construction to start, which is going to happen in the next couple of weeks. So we have had at least half a dozen meetings with the community, challenges with butters. As you can imagine, people have lots of questions and lots of fears and anxieties. And we asked NAMI New Hampshire to come to the table to be able to help us work with the communities, because the state is often seen as the bad guy, right? We're the ones that are, it's easy for us to be the scapegoat, but here it was a great partnership to say, listen, we're doing this, and here's why it is beneficial to the people in the state of New Hampshire, why it's going to meet the service need that we have there. So I am actually very excited about the Forensic Hospital bill in terms of meeting the need, but also seeing the design. It is not going to look like a prison or it looks like an extra building, like the common person walking by isn't going to know necessarily what that is. So I was really pleased in terms of building a secure facility that looks like has a home-like feel to it. So very excited about that. And that's expected to open mid of 2025. There are some supply chain issues and construction issues, as I'm sure many of you are aware. Our children's system of care, I had mentioned adding the level 5 of the PRTF for the children's system of care. This is something, we talked about during COVID, we were actually able to get this RFP out and get the services laid out of level 1 through 4, now having 5, which is great. It's just in terms of staffing is one of our challenges to be able to utilize all of those services on the slots that we have. But we continue to make progress there. And a community focus, moving away a little bit from the inpatient acuity residential focus, was also the New Hampshire Rapid Response, which I'm sure many are you familiar with, and creating that centralized access within our behavioral health system. Someone to talk to, chat, talk, or text, which is that centralized access point, someone to respond, our mobile crisis teams. And somewhere to go, which is really location-based services. And this is something also that you'll see coming up shortly with contracts for crisis stabilization centers. So that's really providing another level of care that may not be inpatient, but it is a higher level of care that is below hospital, but between outpatient. And it would serve ultimately as another spot to go other than an emergency room, and providing care for up to 23 hours. So we're about to pilot those two centers and see how that goes, and hopefully create more. 988 National Suicide Prevention Lifeline launched. I looked at the call volume for March of this year. We had 1,740 calls. Our answer rate was within 19 to 20 seconds. So people are calling, people are picking up the phone, and work is happening there. Critical time intervention, CTI, right? So we use all these acronyms, right? In the beginning, it was CIT training. Now it's CTI training. So our critical time intervention, we started this program back in January of 2022. And the goal was to reduce hospital readmission rates and help people stay in their communities. And although we got off to a slow start, we are now steady at about 10 plus referrals a week, and we have an active client count of about 242 individuals served. So we're very excited about the next couple of years. We're going to work to build out some of our data and reporting systems to assess impact and course correct as we go along, but a very critical program. And also the certified community behavioral health clinics in NAMI, New Hampshire was again a driving force to help us get this grant to be able to stand up to clinics by early 2024. Integrated mental health and substance use disorder issues, creating some good access points, treatment standards, and also a different model for provider reimbursement. So we're very excited, a little bit of innovation there. And looking forward to piloting those two as well as to see if that's something that we can do across the state. Some system improvements that Susan touched on a little bit is, in terms of around Medicaid rate increases. Again, thank you to all the advocates and for everybody supporting that. It is much needed. As you all know, it's currently in the budget process. We'll see where it lands, but I think it was a really good voice of why this is so important, and especially with our system, as well as our IMD waiver. And basically the state's been working with an IMD waiver process for the last couple of years, but really for me at its most simple level to share today, it's one of those things, again, increasing access to beds for a lot of our Medicaid population as well. That was a limiting factor of being able to serve with Medicaid. Some additional accomplishments is mentioned already, the continued expansion of mental health and suicide prevention training for law enforcement officers, first responders, court systems, and DOC. Workforce initiatives to recruit, train, and talented, dedicated people to work in our mental health system. Susan also mentioned our roadmap. We are also looking at creating a focus on some training opportunities there as well. We have loan repayment programs that we've been able to launch as well to help those peers and clinicians working in our system. Creating more supported housing options for adults with mental illness to ensure that the stable housing and access to treatment remain. And upstream prevention messaging, this is on the precipice of launching. You'll see it soon. I noticed some other states were already had launched theirs. A way to instill hope and resiliency, reducing the stigma and normalize help seeking. So we have spent the last year working on that with all of our partners, and messaging is about to launch as well. We are learning more every day about the impact of the pandemic on mental health. As many of you know, during COVID, we saw an increase in emotional and psychological distress, substance misuse, and suicide ideation. And as Susan mentioned, it continues today. The prevalence and acuity is concerning. About 1 in 4 adults are experiencing more mental health. So given that, it's almost certain that we know somebody that's experienced it, if not experiencing it ourselves. Although New Hampshire is in the top 10 states for children's mental health access, we still have a ways to go. We have about 47% of our youth who are considered depressed and are not receiving treatment. And the new CDC data tells that nearly 3 in 5 US teen girls feel persistently hopeless or sad, double that of boys. That's about a 60% increase over the last decade. None of the challenges we face, stigma, workforce, housing insecurity, increased demand for acute care, integration of care, are small, and none have any obvious silver bullets. Although much work and major challenges lie ahead, we will keep on improving and building together. Individuals, families, communities, providers, local, state, and federal government. It takes all of us to row in the same direction steadily and consistently over a period of time before we can see any significant changes and impacts to the systems. It's my hope, and should be our hope, that by working together purposefully, we can look back in years to come at a system that is transformed and meeting the current needs in our state. And I look forward to working on those changes with you. So with that, I will say thank you, and I hope you have a wonderful conference today.
Well, thank you, Commissioner Weaver. I am impressed at how much you're able to fit into such a short amount of time, not to mention how much you've accomplished in your short amount of time in this role leading the team. I don't know if we have any questions that have come up yet. We'll give folks a moment, but I particularly wanted to mention how much we appreciate your leadership, that of the departments, in addressing the needs of our loved ones who are particularly involved in the justice system. I'm very struck when I talk to families of these folks and about how indeed they are often our most marginalized amongst our people, our folks that we serve. And any thoughts for you in terms of things that might be done for us, or in terms of addressing the needs of this population in the ensuing months before, a year and a half or so before we will see that opening of the forensic hospital?
You know, it's a great question, and I know when I tell you what the ask is, that you'll be right there. NAMI New Hampshire will be right there to help support us. You know, the minute the first construction vehicle drives onto the campus here, it's going to create a reaction, and so there's going to be a lot of buzz. So I would really like to be able to get ahead of that and do some messaging together and really educate and inform. And so a lot of it is bringing down people's anxiety and fears, right? There's a lot of people that don't understand. So can we work together? So we'll be doing more public forums, and Susan, we will definitely be inviting you and your team to that. We're probably going to need to do more than that. What kind of outreach can we be doing to be able to educate and inform, as well as if you can help us think of ways to make that facility feel less threatening to people. We are completely open to that. So we will definitely be knocking on your door for more to come.
We stand ready as always to partner with you on that endeavor, and I'm sure a lot of our folks would be willing to support that as well. I think we do have one question in the chat.
I'm not
Michelle, did you want me to read that? Or
No, that's okay. I just grabbed it. I was looking
Okay.
at some from Huva as well.
Oh,
So-
okay.
The one that you just saw is, are there any moves to allow peer support specialists to access the state loan repayment program? They are not currently a listed qualifying provider category.
I can't tell you for certain if it's that particular classification. I can tell you though that we continue to try to expand who is eligible for that. And that is a voice that won't go away. It's really the deciding factors of people that approve that will have the final say, but we will advocate for that as much as it's needed to get to that end.
And
I've
then,
also made a note,
Oh, go ahead.
folks, to add that when we're advocating around the SLOPE fund. So thank you for that.
that's a great one, yes. Is there a website that provides details on the expansion of the hospital?
There's actually on the DHS website, I think it's on the New Hampshire Hospital page, we have listed all of the sessions that we have, which have slide decks on them that have information about everything from soup to nuts of the program, and we'll continue to post more there. There's also, I believe, an email address and a phone number that people can call if they have questions. They can send them there as well, and the hospital will respond.
Great,
We will
thank you
also
so much.
post the next forum on our social media. We do try to make sure when they're scheduled to do that. So folks, stay tuned to social media, and we'll make sure to share it when it's scheduled.
Wonderful, thank you.
Thank you. And we can put some of those details in one of the discussion boards as well, or part of it for this session. And then there's one other quick question, I think, for you, Susan. Can you talk a little bit more about the CIT program and where we would find more details?
Oh, I believe we do have a CIT page on our website, naminh.org, and we'll try and see if we can find it and pop it in the chat to link to the actual page. The CIT is near and dear to all our hearts. It is a 40-hour gold standard training for law enforcement and other first responders and how to respond to people experiencing mental health crises. There you go. The CIT page has popped up in the chat, and part of that training is 2 days really of role playing. So we have some wonderful volunteers who come in to do that role playing, so the first responders can really have, real interactions with folks and scenarios they might very well encounter in responding to these types of calls. So if you're interested, you can always reach out to us through volunteer@naminh.org. Email us if you're interested in becoming a CIT volunteer. And if if you know someone, a first responder is interested in attending CIT training, you can send that along to us at info@naminh.org.
Great, thank you so much. So thank you, Commissioner Weaver. We really appreciate the time that you took to share all your information with us this morning. If we see other things that pop up in the Whova chat that you might be interested in, we'll make sure we let you know so that we can respond to everybody appropriately.
Great, thank you. And I hope you all have a wonderful day.
Thank you so much.
Thank you, Commissioner.
Okay, Susan.
All right, so it is truly my pleasure. I get to do a lot of the fun things this morning to introduce our next speaker and panel. Dr. Ken Duckworth is with us today, along with Dante Murray, Chastity Jacobs Murray, Denise Paley, and Drea Landry, to talk about NAMI National's first book, You Are Not Alone. If you haven't had a chance yet to read the book, I strongly encourage you to. It is truly a book full of hope and honestly love, and it's truly written from a place of love. And there's so much information. It's a wealth of resources. Frankly, I've lost track of how many I have given away to folks. And just want to mention that Gibson's Bookstore, our local independent bookseller here in Concord, has given us a discount code for today that you can purchase the book with. You will get, I think, 25% off. I'm looking at Michelle. You will get it 20%, sorry. Gibson's is wonderful. You'll get 20% off if you purchase it with the code today. Dr. Duckworth will talk about some exciting news where the book is going in terms of having wide market appeal coming up. So let me just first introduce him, and then we'll get started with our keynote. Dr. Duckworth's journey into psychiatry started when he was a boy growing up with a dad who experienced severe bipolar disorder. His father was a loving, kind, and periodically quite ill, hospitalized for months at a time. Ken became a psychiatrist in part to help his father. He talks about that journey in his book. He is the chief medical officer for NAMI, and very fortunate he feels to be part of this community, this NAMI family. Ken's book, You Are Not Alone, The NAMI Guide to Navigating Mental Health with Advice from Experts and Wisdom from Real People and Families, is truly a book of compassion and love, and offers an essential resource for individuals and families seeking expert advice on guidance on diagnosis, treatment, and recovery, and featuring these inspiring true stories from real people in their own words. And you're going to hear from some of those folks today. We are so lucky to have them here. Ken is double board certified in adult and child and adolescent psychiatry, and has completed a forensic psychiatry fellowship. So we are so lucky to have Dr. Duckworth here from our broader alliance, and as well as the folks who have given their time and been vulnerable in sharing their stories in this book in order to offer hope and foster resilience and to help create true change. So welcome to you all. Dr. Duckworth, the stage is yours.
Thank you, Susan, and hello, everybody. I had such a nice little visit in New Hampshire a few weeks back. Your community is remarkable and you're doing great work. I just want to say, having listened to the commissioner, I've been the commissioner of mental health. It's a really hard job. I just want to acknowledge that. And you'll be hearing from 4 people in the book. The book is a collection of real people who use their names and share what they have learned. And 2 of them involved direct interactions with criminal justice and the impact on them and why they worked to improve police training. So as you heard, NAMI has a book now. Isn't that fun? 43 years as the biggest and best mental health grassroots organization in the world, really. I thought we really deserved a book. And I'm delighted to say we have a book. We, NAMI, own the copyright. We, NAMI, get all the royalties. So I get paid to write the book, which was fun, and to market the book, which is pretty good. All the sales go back to our mission and our vision for a better world. So I had the great fortune to meet 130 people who wanted to share their experience. And I could have done more, but I just ran out of time because I was on a deadline because the publisher correctly intuited that we would do better if we had a book that came out during the mental health moment. So the book basically is first-person experience as expertise. And you all know this from your own lives, that you've learned something by living with something. You've learned something by loving someone. Incredibly, there hadn't been a mental health book that emphasized this idea. I had this idea about 15 years ago in my local bookstore in Boston. And I'm like, there's memoir after memoir, which don't help people, but are interesting. And there's textbooks, which no one reads. And I thought, that's not really an optimal thing. I really could have used a book myself that was practical, that had real people, because shame and isolation were principal problems in my own family. My dad, as Susan mentioned, was loving and gregarious, but occasionally quite psychotic, hauled off by the police, communicating with the microwave oven. It was an unsettling and scary reality. He had very bad bipolar disorder and was a very good person. And we couldn't talk about it. So one of my favorite chapters in the book is family communication, and you'll hear from Dante and Chastity Murray about family communication. I also want to let you know that Drea Landry graciously agreed to be part of the book, and she has a lot to teach. And Denise Paley is also going to be on our panel. So what I'm going to do is ask each of them to speak for 5 or 10 minutes, 5 or 7 minutes, about why they wanted to be in the book, what they hope people might get from the book. Then we'll take your questions. I should say, in addition to lived experience as expertise, I also ask the best researchers in America to answer all the questions I get at the NAMI convention. Do I really have to take these meds forever? How do you get people to accept treatment when they don't want it? What is DBT anyway? How do I find a therapist? These are the questions that people ask me. So the book is a both-and book. It's first person, it's family, it's lived experience as expertise, and it's old school experts. So I don't know who would like to start. Perhaps Dante and Chastity, who are in the family communication chapter as a married couple. You know, I was so impressed at how they run their marriage based on the principles of some of NAMI's support programs. So I want to thank you, Dante and Chastity, for joining us today virtually in New Hampshire, and ask you how you're doing and how's your adventure going? Being, you know, famous people now in NAMI's first book, which I should mention has sold 36,000 copies, is in every Target in America. It just keeps going. And the publisher is going to print another 50,000 copies. She just told me last week. They were going to go to paperback.
Amazing.
Paperback is when they give up, but the book keeps selling. So they're going to keep going. So it's kind of cool. Book's been resold in the United Kingdom. You Are Not Alone with Scones is my preferred title, but they call it You Are Not Alone, the NAMI Guide. And then it's been resold in Mandarin. They're looking for a Spanish publisher. So the project just keeps going. So Dante and Chastity, I want to ask you a little bit. I'm going to have two kind of broad questions for you. I'll be asking the same questions of Drea and of Denise. Why did you want to be in the book that shared who you really are? Because every single book in mental health is everyone here is an anonymous, fictitious person. Any resemblance to any real people is purely fictitious. I always felt that that promoted isolation. And I don't want everybody to go on Channel 5 and tell their story. But I happen to know through my travels at NAMI that there are thousands of people that see value in sharing what they have learned. So I want to ask you the first question. What were you think? What went through your mind when you heard about the book? Why did you volunteer for the book? And what do you hope people get from it? And thank you again.
First and foremost, thanks to everybody who's allowed my wife and I to be on here.
And the interview process, we appreciate that team as well, Dr. Duckworth and others. And we find it a blessing to be able to tell our story. And here's why, because we were with In Our Voice,
Yes.
and we did that quite a bit. And that's one of the flagships for NAMI, to do that kind of program, that kind of outreach. I know they talked about CIT, and that's what we did a lot of, doing our personal stories at some of the trainings they did at
And
LMPD.
speeches, we've done a few
And some
speeches.
speeches.
Yeah.
And that's a second nature for us. We love it. We facilitate groups,
Yeah.
FSG, NAMI
Yes.
Connection.
Yeah.
And so this was a great opportunity to evangelize
Yes.
the good things NAMI has to hold out for the community. After all, NAMI is the largest grassroots organization in America.
Yes.
And what better way to tell the message than to tell your personal impact it's had on you? And that's what we did. We find it to be rewarding to let people know what NAMI's done to help our NAMI family here in Louisville and abroad.
Yes.
Mhm.
Isn't it true that you use NAMI as a dating app of sorts? You met each other through NAMI. I mean,
I
that's
knew
the secret sauce of your success, right? You met at NAMI,
Okay.
which you don't
Now
see
it's-
every day.
Now we're getting ready to start like Chick-fil-A now. I can tell you the secret sauce here. So we met at the NAMI rally in Frankfort, Kentucky. I was giving a speech at the Rotunda, and we're advocating for some of the bills that's supposed to be passed to help out with insurance parity with mental health services. And so I got a chance to make my rounds, as people do hobnob around in the lobby area before they do all this talks with the representatives. And I happened to see this young lady here, and I'm like, who's that? And I looked to the left. I said, oh, that's Phyllis. She knows who this lady is, possibly. And so I do my schmooze around and talking, and I'm slyly about shaking her hand and saying, hey, have you been a part of this interim voice process here and other classes they have to offer? Because after all, I'm a train the trainer. Okay. So I'm using every bit of skill sets. I know some people talked about skill sets earlier. You use your skill sets to get the job done. And so she says, no, I haven't been a part of any of those programs. How do I do that? I said, well, if you give me your name and number and email, I'll be able to send you this information to help you out in the part of the trainings.
That's
And
great.
so I did a warm handoff there, then a follow up, and pretty soon I was able to get a hold of her, and rest is history.
Yes.
Lovely. You both live with mental health conditions,
Yes.
Yes, we do.
and you integrate some of NAMI's teaching into your relationship. I
Yes.
love that you talked about that. And I wondered if you could share a little bit about that. Because my
Sure.
family never figured out how to communicate. And so I love people that have figured this out. And so just talk a little bit about that if you don't mind.
Sure.
Sure.
I can highlight some things we use. Check-ins are very useful. We've got a code word. We got green light.
Yes.
We're not trying to have a spin-off of the green light, red light thing that kids used to do, but we use it because it's got to let us know that this is time to stop and check in on a good way.
Yes.
So we don't use red to denote a negative, but a green light to say, look, we need to talk more about this, and let's go in private, because we've got a young child. I mean, he's 18 now, but he's a young child to me.
Autistic.
And it's best to deal with adult topics in adult surroundings. We take a walk, or we go outside the house somewhere. It's just creating a environment for us to really tap into the logical side of our brains rather than the emotional, because the emotional is really going to get us in trouble with each other if we don't pump the brakes and then say, hey, let's find a neutral place to talk about these hot topics. So principal support help us sometimes. Some of the techniques we learned in some of the classes we've taken, FSG and other trainings that NAMI has put on, we've used some of those skill sets to help us out. And we got marriage counseling. We find out what kind of love language we have. That helps tremendously, having those kind of foundations already established in how we best communicate. And once you know how each other communicates and what each other desires to have in that situation, then we start looking out for each other's best interest when it comes to that.
Definitely.
It's anybody can yell and scream, anybody can get upset, and stomp around the house, whatever. But it takes a lot of effort to say, let's sit down and negotiate this thing. And that's where the relationship becomes more of a responsible interchange of words and go from there. And our spirituality, we can't leave that out.
Oh, good. Yeah,
You know,
definitely.
mental health is holistic. You know, mental health includes everything for us, from the Bible to our spirituality, higher power, books that we've read, you know, all other things that can help us be stronger. You know, no marriage is perfect.
No, definitely not.
Gosh, Chastity, you said that with such, you agreed so quickly.
She's in a peanut gallery.
You jumped right in on that one. Chastity, do you have anything else to add before I go to the next person in the book? Because we're going to be able to take questions at the end.
Yes.
Chastity, do you have any other thoughts you'd like to share?
Well, like I said, I've been with NAMI for 14 years,
Mhm.
promoting NAMI, and it's just been a rewarding to be able to be here.
Yes.
NAMI for NAMI
Mhm.
Hampshire, New Hampshire, excuse me, for being able to do this.
Mhm.
The book, promoting this book has just been such an honor.
Yes, it is.
To be able to do this has been such an honor.
Well, thank you both. So we'll come back for questions at the end, and we can talk about, you know, a little bit more about your relationship and how you use communication strategies learned at NAMI. In the Q&A, you can, you know, really ask us anything. It does occur to me that everybody on this panel happens to be engaged with CIT training based on an experiences that they've had. So it's highly germane that I jumped on early to listen to your commissioner talk about the importance of this work. And of course, NAMI was central to the development of CIT training with Major Sam Cochran in Memphis, Tennessee. Drea Landry, I want to thank you for joining today and being part of our conversation. And tell me a little bit, you've helped me with several of these talks as well, and talking about your own recovery journey. Tell us a little bit about why you wanted to be in the book and share your story. And thank you again.
Thank you for having me. Um, I remember how alone I felt when I was first diagnosed with bipolar disorder, PTSD, and anxiety, and just feeling like there was no cure, no way out, and um, I didn't want anyone else to feel that way. Once I saw my first Inner Own Voice presentation, I was like, yes, I want to do that. I want to get out there. I want to spread the word. And if I can just reach one person, I have touched many, because one person spreads the word.
Now, Drea, you've had some interactions with police, and I know it's not easy to talk about, but would you be willing to share your experience and what you learned from that?
Sure. I actually grew up in a law enforcement household. My mom was a parole officer and a prison guard. So I had an idea of exactly how law enforcement approaches certain situations. When I engaged myself, it was actually quite scary. I found myself in an disagreement with my ex-husband. We had gotten into an argument, and sometimes I have anger management issues. So in order to help me get through some things, I go and ride a train or a bus or whatever, just get out alone so that I can work out my feelings. And this particular day, I went out and about, and my husband did not know where I was and called the police on me. And ordinarily, an adult person can go missing for 72 hours before the police decides to come looking for you. However, if you have a mental health condition, they come looking for you immediately. And when the police asked him if I was a danger to myself or others, he said, I don't know what her problem is. So they came to look for me immediately. And when they called me and I told them where I was, the young woman, she approached me with her gun. So I'm instantly with my hands in the air, because she has her hand on her gun, and I'm saying, "Okay, I'm scared. Please don't hurt me. Don't shoot. I'm good. I'm not armed." And let her know who I was and walked her through as I reached for getting my ID. Yeah, I'm going to move my hand to grab my phone so that I can get my ID and you can see who I am, as she was asking me questions. And as I walked her through, what I was reaching for so that she didn't think I was making any sudden movements. That helped her be able to talk with me and to understand that I was not a threat, not only to her or to myself. And being a part of the CIT programs in Maryland, in Baltimore, that was one of the things that I would tell officers, I realize that you're afraid and that these situations can be sometimes volatile, especially when someone is really symptomatic. But if you listen to what the person is saying, they may not be as well spoken as myself as to walk you through, hey, I'm reaching for my phone. But if you're listening to what it is that they're saying, even in their heavily symptomaticness, you can get through without the use of severe violence that could hurt someone, that could kill someone, that could get them to that point. And both of you can come out on top.
I'm impressed, Drea, at how much presence you had when you were in a crisis and you were thinking of the police officer's response and experience. I just want to say how extraordinary that is.
Thank you. I remember asking my mom a question once because I remember seeing this. I asked her, why is it that 20 cops show up to one site, whether there's someone being pulled over or you have a suspect that you see running and all of a sudden you see all these 1 million cops coming towards this one person. And one of the things she said was that sometimes they're sitting around and they're bored. And so they all show up all at one time to give them something to do. But then when things get heightened, it becomes over the top. And that made me think about, okay, this can become over the top. And, cops have a bad habit of shoot first, ask questions, never. So if you take the time to walk them through and help them understand what you're going through, even though you don't understand what you're going through, it makes the situation come out a lot better. And even as I have talked to law enforcement officers and the CIT trainings through this particular process, I do the same thing for those of us who are living through mental health disorders. Talk to the officers who are there on scene, even when it feels like you're being delusional, even if it feels like you're not all there, don't have all your faculties, do the best you can to express yourself as best you can, because you may not be as reasonable as you are right now, but you're still speaking your truth.
Well, thank you, Drea. So you'll be available for questions later, and thank you for everything you're doing. I gave a talk to NAMI, Connecticut. Again, the process of finding people was fairly random. That is to say, I trusted that if I interviewed 100 or so people, I would capture the waterfront of NAMI experience. And Denise Paley was kind enough to volunteer from my little chat at NAMI, Connecticut, to share her story, which again involves the police and her work in training police officers. So Denise, I want to thank you for joining today's conversation.
Thank you. Thanks for having me here. So first off, why I wanted to be in the book to begin with, it really centers around shame. So, my son had his first onset of psychosis that led to his interaction with police. And so here we have an incident where my son is, now living with a very serious mental illness, which has its own umbrella, wraparound shame associated with it, and he's arrested, right? So I just felt like I had one of two choices. I could either go into hiding and let this cycle keep perpetuating itself over and over and over, or I could try and do something about it so it doesn't have to happen to anybody behind us. One of the most common questions I get, or the most common points that are made to me, is that people are so shocked by my by Ellis's experience. They can't believe that this happened to him in the way the police interacted, and the fact that they were so unwilling to listen and did not have the training. And people just assume that that police officers have crisis intervention training, that this is the job that they have. So of course they're ready to do it. And it's always enlightening for people to see that this is a cycle. This is not, Ellis is not an isolated incident. He's part of a system, a cycle that has been going on for, years and, for decades. And if people don't step in and change it, it will go on for decades more behind him. So I just think it's been a good point of education for others. It's been a good point of education for myself. I was, truth be told, I was one of the masses that believed our criminal justice system worked a certain way and that it was functioning as it should. And I've been very enlightened to how it does not, and how it does not serve especially people with mental illness in Connecticut. So we've been able to, I joined NAMI. I'm relatively new. I've been with NAMI for about 3.5 years. That's how long my son has been incarcerated for. And I'm on the board now. And one of the things that we did was we have cable in Connecticut. So it's the Connecticut Alliance to Benefit Law Enforcement, and they do all of the crisis intervention team training. They do it for the state of Connecticut. They also do it in Rhode Island. They're an excellent organization, but it is voluntary for police officers to participate. So to encourage participation, our NAMI affiliate on the shoreline of Connecticut has offered to pay, like we will, whatever the state doesn't cover for their training, we will pick up the difference and we'll pay for the police officers to attend. You would think that would be enough, and it has not been. So I've been advocating, as you know, Ken, with the Public Safety Committee in the state of Connecticut.
Could you talk a little bit about your advocacy, Denise? Because
Sure.
I'm so impressed that you've been through so much with your son. And in a relatively short period of time, you've become kind of the sine qua non of the NAMI advocate. Can you talk a little bit about what you're working on in Connecticut?
Yeah, so I've advocated for a number of bills, some to improve conditions for people who are living in incarceration. One, to end the abuse of solitary confinement in the state. Regarding, Ellis's incident particularly, because, he had the police were his first point of contact when he was having his break. And it's at that intersection where they had the opportunity to recognize he was having a crisis. We actually said we did not think he could possibly be in his right state of mind based on some of the things that he was doing. And I was actually told verbatim he was not experiencing a psychotic break, like verbatim. And we all know how that ended. So one of the bills that's actually going through right now, and I'm learning a lot about how long it takes to make a bill a law. So, but this, I've advocated to mandate crisis intervention team training for police officers and to allocate funding to support it. So just this session, there's a bill that is going to require that beginning July of next year. And we're 99% of the way there. So it passed through committee without any 100% votes yes through the committee. It went through the Senate, 100% votes yes, no no's. And now it's going through the House, which is any day now. And I'm anticipating another 100 votes yes. And then this will be part of their training curriculum.
That's fantastic. Now, you also had a police department that did better for your son, if I remember from our
Yes.
interview. Could you talk a little bit about that?
Yes. So our local police department, who we were working with to detain our son, to hold on to him, because they had found him at some point, right? So they did not have the training. They lacked the training. When Ellis was arrested, he was arrested by a police department where they did have the training. And I think about it, I mean, as awful as it's been, I think about how lucky we are, because the police officers that when they had called in the incident, because it was the middle of the day and just, it was just so, like, I don't know, just random the way things were happening. They called it in, I guess, as a code blue, which means that it's somebody who's looking to die by suicide. So it could have gone really poorly. And the police officers that arrested him had the training, and they knew exactly. I've seen the video of his arrest, and nobody handled him roughly. They were very calm. They were very gentle with him. They knew exactly how to get him out of the car, how to put him into the police car. They walked with him. It was as nurturing of an experience as you can imagine, considering it was an arrest. Shortly after our child's incident, there was another incident where there was a child a year older than ours who had had something similar happen. And he was in his car, and, I wasn't there. I don't know what, but he was having a crisis. He was in his car. His family had called the police and said he had a known mental health illness, and he was shot through the window and died. And he didn't even have the opportunity to put his hands on the steering wheel to get out of the car. So I know our story could have ended much more tragically than it already has. And I'm very aware of that.
Well, Denise, I want to thank you for everything you're doing. I'm so sorry you've been through all this, and NAMI is lucky to have you. So I think, Susan, at this point, we'll open up for questions and conversation, all in a way organized around both CIT and, in Dante and Chastity's case, communication strategies and their teaching in CIT. So we could talk about anything you'd like, including how your book might go. Is NAMI having another book? What can you do with CIT, learning from what is being done in Connecticut, what Dre is doing in Maryland, what Dante and Chastity are doing in Kentucky?
Great. Michelle, do we have some questions?
Sure, I was just pulling them up from the Who app. So the first one was, what are some of your favorite books that inspire or drive you? And I think this is open to anybody.
I'll just start by saying, in the back of our book, I asked all 130 people their favorite resources, and I listed them all by chapter. So when somebody said to me, the book that made a difference for me is, I would include that in the back of the book. So just so you know, there's a lot of resources in our book, because I know there's no one book that captures everything. So I just want to mention that if you happen to pick up the book, or next time you're at Gibson's, you look at the back of the book, you'd be like, oh, organization, book, blog post, organization, book. So it's very intentional that this should be kind of the definitive resource for people. But I'll let other folks add to that.
Well, I'm going to say the number one book that I recommend is yours, Ken, because it's just so comprehensive. And I think it teaches people that they don't have to be a bystander, that there's hope. Susan, I think that's how you kicked it off. The book represents hope, and it's true. It teaches you resources, and it helps you feel less alone and makes sense of what's happening, and teaches you how you can take action. Another book that was given to me as a gift when very early on with my child, it's called Fix What You Can, and it's by Mindy Greeling, and she's a former legislator, and she has a son who has serious mental illness. And the book is about, as a legislator, her trying to make a ripple in the criminal justice system, and how hard it was for her when this was her job, when this is literally what she did for a living, but how unpopular mental illness is or was for her as a topic and of laws to change. And that's a book that I leaned on a lot.
Drea, Chastity, Dante, any books or resources that have spoken to you?
Yeah, I actually have 3. and I'll make it fast. The first one, well, obviously we'll make it 4 hours, of course. The one that helped me come to acceptance with my diagnosis was Kay Jamieson's book, which is The Unquiet Mind. Just in reading that, I connected with her and could relate to a lot of the things that she was doing and how she accepted. The second book, which really stuck me as a woman of color, is Maya Angelou's I Know Why the Caged Bird Sings. And that really helped me come into terms and come into my own. And then the last one, which not only touched the kid in me, but also helped me remember how much I love to travel and just explore and do things. And that is Oh, the Places You Will Go by Dr. Seuss. So those were very instrumental for me.
Dante, Chastity, how about you?
Well, we had a book that was given to us when we got married,
Yes, we sure did.
and it was by Gary Chapman, The 5 Love Languages.
Yes.
And so that came in handy as we were progressing on in our marriage during COVID. And so here we are, stuck together, close quarters. We got this book on five love languages. And we're like, this book came in the mail just in time because
Yes.
we were not using love languages stuck in those quarters,
Yes.
you know? So it was really tough sometimes, but the book came in handy. You know, we called, time out, let's get the book. We look at the book. We're trying to hurry and find the answers to these things. But we had plenty of time to really meditate on the book. And
Sure did.
another thing that came as a really good support for us was our spirituality. And then we obviously, if you have that kind of spirituality about God and then your Savior, the Bible's going to be essential. You know, the Bible helps quite a bit. Just finding the scriptures that apply for the moment, and prayer helps us a lot. And sometimes when we get upset, she'll say, "Let's pray."
Yes.
You cannot argue when your wife says, "Let's pray," even if you're right. You gotta say, "Oh, okay, let's pray." Easy into a conversation if you think you're right at it. Can't
Hard to argue in a silent moment of
You
reflection.
put God right in the middle of that thing, and I was like, "No, okay."
Yeah. All right, thank you both. Chastity, any book speak to you?
It's basically the same book because
Okay, good.
my aunt actually is the one who shipped the book to us.
Mhm,
She said this book will help keep your marriage
mhm.
completely for 60 years because she's an older lady and she's amazing.
Yeah.
And she said anyone who keeps this book
Mhm.
has a wonderful marriage.
And it helped to have a father-in-law that's a pastor, so he helped out quite a bit too.
Yeah, my father is a great
Yeah,
man. He
yeah.
does marriage counseling and
He married us off on Zoom, so
Great.
we're following all the protocols, and it was great. Good
Yeah.
experience.
it was a good
Yeah,
experience.
yeah.
It sure was.
All right, Michelle, do you have another question for us?
I sure do. Was the biggest, what was the biggest impact while writing this book? And this is for you, Ken,
Oh.
obviously, from your own journey or hearing about other people's journeys. So the biggest impact.
Yeah, so I consider myself kind of a radical recovery community psychiatrist. And if you were to hang out with other psychiatrists, you would see that I don't exactly fit. That is to say, I don't do traditional outpatient care. I've always done public health jobs, systems jobs. But when I put together a book proposal, which again, I'm a rookie author, I'm a one-hit wonder. When I put together the book proposal, I had a chapter called The Power of Community, because I had seen that. And I interviewed people from Fountain House, the first clubhouse in America. I interviewed people from the Me Too Orchestra who were at our event a few weeks ago. I interviewed people from the Depressed Cake Shop, people who had found each other. But I had to change the name of the chapter to The Power of Peers and Community. Because even as I was so far away from traditional psychiatry towards the peer experience and the value of peers, in doing 130 interviews, one person after another said in different ways, it was all the same theme: peers, becoming a peer, helping others by being a peer in service, was among the most valuable parts of people's recovery journeys. People would say they go into a state hospital and they say the person who helped me the most was the person next to me in the day room. I want to emphasize this. I was never taught this as a psychiatrist. I thought all the things we were doing in the treatment room were helpful. That's what I was taught. And he would say, no, the guy next to me, he was really the most helpful. I met a man named Patrick Kaufman. I did a beautiful event in Kalamazoo, Michigan. And he said he had a lost decade of homelessness, psychosis, and addiction. It was all in the book. He and his dad are in the family communication chapter. And he said, I realized I wanted to become a peer and that I thought becoming a peer specialist was the perfect job. It took me a while to realize that that lost decade was part of my training, that I had been psychotic, that I had used addiction as a way to cope, that I had been homeless, that I had become estranged for a time from my family. These were all exemplary qualifications for what I consider my dream job. So to me, the power of peers was the biggest takeaway that I had. And the second lesson I had was I was working with a 24-year-old co-pilot named Jordan Miller. And I learned that we couldn't do 3 interviews a day. We were on quite a pace. Like we were, they really wanted this book kicked out with a very tight deadline. And what I learned from her was that we couldn't do more than 2 interviews in a day because some of them were quite poignant and powerful. And she had no training for this. So what we did is we would do an interview and then we'd take a half an hour and talk about it. What was that like for you, Jordan? What was that like for me, Ken? Then we'd take a couple hours off and I'd either write or worry about writing. And then we'd reconvene with another fabulous interview. So those were 2 things I learned. One is the power of peers. And 2 is you need to respect the pace because lived experience is powerful and beautiful, but also has an impact on each of us. I interviewed 8 people who lost family members who died by suicide. And those interviews were hard to do. They were hard. And those people were full of love and had found a way to make meaning of it. And so that was a good lesson along the way to recognize that I could only do 2 in a day max, not 3 in a day. The pace was intense and I blew out both my elbow tendons. I went to see a physical therapist. It's hilarious. I was typing so much. So it was a great privilege. And I feel very fortunate that NAMI supported me in helping us to have our first book and bring all these amazing people to life. I gave a talk in Oklahoma City to their little affiliate and on a virtual chat. The night that I was in New Hampshire, actually, I don't have an admin and I completely screwed up the timing. So I went from A to B. And so, Michelle and her team had arranged for me to have a little conference room. And I asked them how it was going in Oklahoma City. And a woman raised her hand and said, I work at the local library. All 20 copies of You Are Not Alone are checked out. And I thought to myself, we did it. We did it. Where people don't have to learn about NAMI too late. They don't have to learn after they've lost their relationship or their marriage or anything. So it was really a great privilege. And while I knew that going into it, traveling across the country and meeting with people, that's the other big takeaway, is just how lucky I was to do this. People are high-fiving me in Rhode Island last night. I never thought stories like ours would matter. I don't know. It's really beautiful. I want to give this to my son. My son needs this book so badly. So just how lucky I was, to have my one-hit wonder be something that I think our community values. And I'm grateful for that. So those are my 3 takeaways. Peers are more powerful than I thought. You got to pace yourself. And what an incredible privilege that I have had writing our first book.
Great, thank you. And we had comments after the event that you were up here for saying, I don't think he's going to be a one-hit wonder. There's way too much that's going to come from this.
Yeah, we'll see. We'll see.
So the next question is similar, but I think if we pose it to the panelists maybe instead. So the question was, what's the most impactful thing you've learned from your experience in writing this book? Maybe we change it to as being a part of this book. And any of you can go first.
has stardom gone to your heads? That's another way to answer the question. Like now that you're rock stars in Kentucky, Connecticut, and Maryland, respectively.
Well,
Oh, absolutely. Can't you see how big it is? It's circumference is all right here and everything.
It's
I'm
actually
I'm
quite
very
the opposite. It's very humbling to be, because the whole book is so important. The fact that, for me, the fact that I'm included in it, or that this, our story is included in it, is just so humbling. I just think it's such an important book, and I get to be in it. You know what I mean? It's hard for me to make the association that I'm part of it.
I think that we ought to make a docuseries on Dr. Duckworth. Take all these clippings and put them together on Netflix. And
Oh,
Yeah,
yes.
yeah, Dr. Duckworth, Yana community.
yes.
You
Well,
are
a
not
couple things about that. PBS of Emory University in Atlanta reached out to me and said, "You got any people from Georgia?" I got people from 38 states. Let's go. So I have 3 amazing people from Georgia. The Georgia PBS program called Your Fantastic Mind is running tonight in Georgia.
Oh,
And it'll
wonderful.
run nationally. I'll get the Marcom team in the fall. It's going to run on every TV station. It's simply 3 people in the book who happen to be from Georgia. One is Tara Carter, who's a mobile crisis peer specialist. One is Kenya Phillips, who's really done work in her faith community to integrate her faith and her experience of living with bipolar disorder. And one is Elisa Norman, who has spent a lot of her own time sorting her own experience of what's for her and what's part of her faith in terms of the hallucinatory experiences she has had. 3 amazing people, but it could have been any 3 people. The people in the book are amazing because the people in NAMI are amazing. And so the people who volunteered are good representations. I have a question for you, which is related to Michelle's question. Has anybody contacted you? I mean, we've got 36,000 copies out there. The book is out there. It's happening. Has anybody reached out to either of you or any of you and said, I saw you, problem solved A, B, or C? Because this is what I hoped, was to create a series of role models in the world.
I haven't had anyone reach out to me as of yet, except for when I've mentioned it myself, that the book is available and the interesting stories and everything. So I've had people comment on account of that, but on an individual basis, I haven't.
So we have work to do to promote our efforts still.
There's always more work to be done.
Yes.
Because the message is so powerful. It needs to go to all parts of the world, all parts of communities. And the thing is, mental health goes beyond just, superpowers like United States or Canada or Great Britain somewhere. We have to get to third world countries who don't have as much of a interaction with mental health education. So I'm talking about like third world countries who may not have those books available. Maybe get some audio books to the people, or I don't know, how do we reach out to people with sign language? I mean, do we have a market for that?
Or blind.
Or do we have
Well, we have an audio book.
Yeah.
We do have an audio book, but we don't have, anything in Braille yet. And again, the publisher, we're all new at this. NAMI never had a book.
Exactly.
I'm just saying it's growth. There's a lot of room for growth. There's a lot of
The
room.
publisher loves us because we delivered a book that's a bestseller, the USA Today bestseller list, on time. And they notice it keeps selling. So they're happy with us. And they commissioned a second book for Parents Guide that'll be out a year from now. And happily, I am not writing that book. For the preservation of my marriage, I am not writing a second book. So I just want to emphasize, spouses go through a lot. If you see an author, it's like, think of the spouse, because they go through a lot too. But Christine Crawford is working on that book. I'm sure she curses my name every single day. But that book will be out in about a year. Again, a copyrighted book that is owned by NAMI. And she interviewed a bunch of people and talked to a bunch of experts, like, using the same model.
Yeah.
Yeah.
I still want to vote for a docuseries for Dr. Duckworth. That's my vote. If we're going to do any expansion on this project, a docuseries on Dr.
There we
Second.
go. There we
There
go.
you
Yeah.
Yeah. You're gonna go for 7 seasons.
My children will watch it. That's about it, I think. Michelle, do you have other questions for us?
Oh, there are a lot of questions coming in. This one is, what is the hardest topic you had to write about, Ken?
So there's a chapter called The Hardest Family Questions. This was a really hard chapter to write. And in that chapter, I interviewed people who took on some of the hardest questions that I've ever been asked. How do you handle it if your family member doesn't see that they're sick? This, of course, can be part and parcel of a psychosis. And how did you communicate with that person? I interviewed a man named Carlos Larari, who describes psychosis not as a break, but as a fog. And then he can see reality, then he can't see it, and then he's lost it again. And to me, I wanted that experience to be clear, then how family members work. Then I had Javier Amador discuss his work in LEAP model, and I am not sick, I don't need help in the expert section. The other part that was hard was a family member named Mark DiGregorio from Connecticut, who again just randomly joined, just signed up. I was at NAMI Connecticut, and he said, Ken, my daughter's never going to get better. And she lives in a nursing home. She's on clozapine. NAMI talks about recovery. She doesn't have recovery. She has lulls in the intensity of her symptoms. And I have to get to the place where my life is devoted to making her life have meaning. It's very beautiful. I teach family to family not to make my daughter better, to make me better for her. So this is a man who represents a whole swath of the NAMI community. Scientific tools are limited, but love is pretty unlimited. And this man is a postal worker. I had no idea what we were going to talk about when we did this Zoom interview. He just signed up to be on it. And when we ended that call, I said to Jordan, my co-pilot, this is such an important conversation, because the truth is it's not all easy stories in the mental illness space. And no matter how much you love, obviously interviewing people who'd lost family members who died by suicide, that was an intentional decision I made because I feel that NAMI has underserved people who've been through that. And so as the author, you get to make up what you want, right? Nobody said, Ken, you can't discuss co-occurring disorders or trauma or people who've lost family members. I did those three intentionally because I'm trying to help NAMI integrate those topics into our work more, because I think they're important. So each of those, was just, heartbreaking because these family members were loved and the family members are all left with questions. So it's a good question. It was an intense journey. And the other thing I'll just add as an aside is I went back into therapy because I would spend weekends trying to remember everything I could about my own life and my own childhood. And, I'm 60. I'm not a kid. So it's all kind of memories, but what I learned is the excavation process of my own little story, which is 1% of the book. I want to emphasize, not my memoir, but I'm part of this, as all of you are too. And I got so upset by thinking about some of these things. I contacted my old therapist and I said, hey, Ann, I'm back. I need to see you again. So an unexpected side effect of the book was that I had to go through my own little process of re-examining my own memories. And of course, the love I have for my father is immeasurable. My siblings both died of cancer, and that's a big heartache for me. So the last person on earth who knew my father as a boy is my cousin. And he and I have nothing in common except a love for our fathers and mothers. And I would call him almost every day. His name is Jim Duckworth. And I'd say, Jimmy Duck, tell me something positive about my dad. And he would give me he had so many stories for me. So it also improved a relationship because I was looking for someone who could help me balance some of the hard stories, which I was excavating. A long answer.
That was a great answer, though. Denise, I saw you unmuted. Did you have something that you wanted to share?
I happen to know Mark. We're not in the same affiliate, but Ken had spoken about his devotion to his daughter, and he really just I know him because just through NAMI in Connecticut in general. And his story really is remarkable. He had adopted his daughter, and he has never, and now she's, an adult, and he just has not given up, on her at all. And it's just amazing to see him fight. Also, the point on death by suicide, since I've been more active with NAMI, it always shocks me that generally in the public, people don't make the association between mental illness and death by suicide. How many people don't see the connection there? So I'm glad that NAMI is doing more, and we've been more active in Connecticut too, in raising awareness, and also we have and promoting 988 in our local affiliate.
Thank you for sharing that. And Susan did put in the chat some resources that we have here.
NAMI New
And
Hampshire's been one of the strongest states on this. And I had your legend, Ken Norton, review that chapter for me. And he provided a lot of the resources because I was aware that NAMI New Hampshire had been so advanced in this area. So I want to thank you all for the work you're doing.
Ken does seem to be in the audience today, even though we can't see him. So he's listed as a participant.
Ken's in the audience. Hello,
He's
Ken.
waving.
Thank
I
you.
saw his emoji wave.
Oh,
Yeah.
Thank you, Ken. He turned around a weak chapter in 7 days and he made it better. So I just want to thank him. It's not easy being part of the orchestra.
Great, thank you. Thank you, Denise, for bringing up 988. And in here we have, here in New Hampshire, we have the Rapid Response Access Point. And so we will be sharing those resources as well in the chats and in the different discussion boards on the Whova app. Next question for you, Ken, is where did you find the people to share their experiences?
Yeah, so it was fairly random. I give a talk to NAMI, Wisconsin. Just people say, Ken, would you give a keynote address? And I'm like, I'm their doctor. Let's go. So I would just give an address on the greatest hits of science or the greatest hits of what I saw happening at NAMI. These were mostly virtual talks. It was all during the pandemic. And at the end, I'd say, I'm writing NAMI's first book. And I don't know if this is of interest to you, but I want you to know that if you want to be in NAMI's first book, send me an email. I'm taking all comers. You have to be in a place where you're willing to use your name and say where you're from, because I find anonymity and isolation to have been a principal problem in my own little life, and is the reason a kid who was not particularly good at science became a psychiatrist, right? To me, I was trying to address both the NAMI story, the NAMI resources, but also to get at the idea, real people have this. Millions of real people have this. And so NAMI Georgia, NAMI Connecticut, where you just met Denise and her colleague, Mark, who I just mentioned. I think Dante and Chastity, it might have been through the Peer Leadership Council. I let the Peer Leadership Council at NAMI know, hey guys, I'm writing NAMI's first book. You want to be part of it? Feel free. Don't worry. The ship is leaving. The plane's flying. I got 100 seats. It was actually 130 people because I just couldn't stop because it was so interesting. And I kept learning things every single time. It was kind of amazing.
Yeah.
But the Peer Leadership Council, people just volunteered. And I took all comers. I didn't exclude anyone. So basically the first 130 people who hopped on the plane, I think are somewhat representative. People were from 11 self-identified race and ethnicities, 38 states,
Did you?
25 religions, 50 occupations. And I did hear about Kumi McDonald in Hawaii from a NAMI staffer. And I thought it'd be fun to go to Hawaii. So I asked Kumi McDonald if she'd like to be in the book. So there were a few ringers, but relatively few. One of the best public health students I ever had in my 20 years of teaching at the BU School of Public Health, lives with bipolar disorder. She's from, the South Asian community and really feels that nobody talks about this. And so I said to her, Suk, would you be willing to be in our book? So there's a few people I asked, but the vast majority of people found me.
And actually a question that I have is, And you talk about this, and you just mentioned it, right? That you wanted people to be able, to identify themselves in this book. So for the panelists, did any of you hesitate? Was that concerning for you to have your name published along with all of this? Or was that maybe what drew you to be a part of it?
I will say something. It was for me because of with my situation of what happened to me with my mental health. So I was a little apprehensive because of my story and how it's going to affect everyone in a good way, but I was still afraid to get it out there because of how in depth my story is. And it was really hard for me, but it was great because to help someone with the mental health is just a rewarding. Being able to advocate and support people is a blessing.
Yeah. And my wife has made my advocacy much stronger.
Thank you.
Thank you.
I will say, I found myself in a unique situation where our community was very supportive. So, and I know a lot of people suffer with sort of being shunned when mental illness kind of bubbles to the surface. And I've had many people reach out to me privately about their own experiences with living with mental illness, whether their own or a loved one or their family member. And I think that's part of why the community was so supportive. I got a lot of private notes, that indicated that. But I applaud everyone who had the courage to give their names and come forward, because I truly believe this is how we end the stigma. So unless we're willing to have a conversation, the stigma is going to continue. And it's difficult and it's hard, but you need things in place, like job security when you're going to do that. But it's true. Mental illness is one of those things where you need to I went to my company first before agreeing to be in the book and just said, hey, I just want you to know I'm doing this, are you okay with it? And I do think that we need to have the conversation and we should fight against the stigma and not let it be a source of shame, because mental illness is only a tiny piece of who anybody is.
Couple of things on the editorial side that I should add. My team sent people their quotes and said, is this okay to attach to your name? Like, you can edit out anything you want. You're allowed to change your mind. You can jump off the plane with a parachute at any time. The plane's flying. We have a critical mass of people. And I wanted people to be able to read their exact quotes. Are you okay with this? And the other editorial decision I made is we don't mention anybody else who hasn't signed a consent form. So if you had a problem with your ex-wife and her name was Joan, Joan is not mentioned in the book. The word Joan does not appear. So the idea is these are real people who've thought about this, are in a place that they want to talk about it, but no one else is revealed in the stories. You could say Anita Herron talks about Nami Homefront and transforming her relationship with her father and how that communication helped her to become much closer to her dad. I don't mention her dad's name. That's an editorial decision. I said to Anita, would you please review this idea with your dad before we publish it? And there's 100,000 of these. I know he's not named, but I just want you to know that if you want your dad's story about how much you transformed your communication, I would love for you to discuss it with your dad. So that's kind of the strategy we use, and then giving people the permission to say, I don't want this quote, or don't use that quote, or whatever. I think we went for maximal collaboration and consent in the process of the book, which is why I went gray. I had black hair before the book began. I want to emphasize that. I was a young man in my 30s when I began. I woke up a gray-haired man in my 60s with bad joints. How did that happen? I can't explain it. But the idea was this became a virtual community that I began to just love and cherish. And the last thing I wanted to do was to hurt anyone. So I didn't sleep all that well, actually. I would be anxious. Are you sure this is okay? A drummer named Snake Sabo, who played with John Bon Jovi, he discussed being molested as a boy by neighbors. And I actually reached out to him and I said, Snake, are you okay with this? Because I just want you to know it's not some famous musician. And he points to all his Grammys or Emmys behind him. I think it's Grammys. He said, Ken, I'm 58 years old. I got 16 Grammys or 6 Grammys. I don't remember the answer. Ken, nobody can hurt me now. And think about it. If this happened to me, it's happening to other people. And I turned to addiction to deal with my trauma. And that cost me a lot of heartache and relationships. And I thought to myself, I just love this community. The people made a decision. They're going to share what they went through in order to serve other people, which is really kind of the highest form of art. And it's also the reason I gave all the royalties and the copyright to NAMI, because I didn't want to benefit from people's stories. That is to say, I couldn't live with that as a possibility. So I just felt like this is bigger than all of us. And that's why if any of you buy a book and you want a book plate, Michelle, just gather, how many book plates you want. I mailed 65 to Ohio last Friday and 65 to Chico, California. And unfortunately, we're not in person, or everyone on this panel would be signing a book with me as I did in Rhode Island. But if you want, a signed book, this is all about a love gift, from all of us to everyone in the world. And so I like signing book plates, because other than my daughters asking me to sign checks, nobody ever wanted my autograph.
Thank you, Ken. And we will definitely take care of that. Go ahead, Drea.
I just wanted to say one thing really fast. And the reason why I wanted to put my name on it is because I believe one of the other panelists mentioned stigma. Whenever you hear about any school shooting or anything that has to do with mental health, the first thing people do is give you this, you look like the monster under the bed. There's this big Charlie Manson look-alike, that all of us, those of us who live with mental health issues, we look like the monsters that's gonna attack you, that's gonna do all of these mean, nasty, crazy things. But I look like a regular human being. I look like your grandma next door. Well, maybe not somebody's grandma, even though I am, but I look like a regular person. And that's why I wanted to put my name on it. We are not the monsters under the bed. We are people who have lives, who have families, who have businesses, who work, who thrive, who are out there in the community, who are walking right next to you taking the train, the bus, driving our cars, everything. We are regular, everyday human beings and not the monsters that everyone likes to presume us to be. That's why it was important for me to put my name on.
We could just drop Mike on that comment.
That's right.
There's a literature that shows if you meet people who are like you, this is Patrick Corrigan, University of Illinois. He's done this work on improving attitudes. And the idea is if you meet people that are like you, your attitude is likely to improve, which is why the In Our Own Voice is so successful. Ending the Silence is so successful. And why I went for such a diverse group of people in the book is I wanted anybody who picked up this book to be able to say, oh, there's somebody just like me. That person does sound like my grandmother, right? That person does sound like my sister. And that was the hope, but Drea said it quite beautifully.
She did.
Anything you want to say, honey?
Are you good? Okay, we have another question about, do you have a book that you could recommend for younger children? And I know you said that Dr. Crawford's working on a book similar to this for about a year, but are there any books in the meantime you could recommend?
I like a book called The School of Hard Talks. That is motivational interviewing with your teenager by Dr. Emily Klein. I've now got into the blurb business. I blurb other people's books, right? I seem to have figured out how to write one book, and people are like, hey, Ken, will you read my book? I read this book and it knocked my socks off. The School of Hard Talks. It's on Amazon. Emily Klein. It's in paperback. I think it's $12 or something. It's short money. And it's a great strategy on how do you talk to your teenager. I just think it's so compelling. Just came out about a month ago. And, I just think the world of motivational interviewing, which is a technique on how to do communication. I had Bill Miller, who invented motivational interviewing, at the back of the book, discuss how do you talk to people who aren't really ready to get help. And Emily Klein has taken this to the teenage audience. And she's also a lovely person. So that's like my new favorite resource that's out there.
That's a great one. And Kimberly did put it in the chat for those of you that are interested. Anybody else have any thoughts on books that for children or teenagers or young adults that you think might be helpful? And it's okay if not. Okay. And this is another great question. And I'd be really interested from the panelists to see, your perspectives on this. I know we offer a lot of this here in New Hampshire. Is there a place to connect with others in similar situations to yours? Where did you all go to connect with people? I know you reached out to NAMI.
Are you guys talking about how to have a network of people?
I think so. I mean, that was a quick, simple question.
Well, prior to COVID crisis, a lot of times I would meet people who are my peers either at rallies or conferences, conventions, things like that, and broaden your network beyond your local affiliates. That's how I would, keep my networks going, being a part of those kind of programs or public events. But since, COVID has come and gone slightly, now that we have Zoom, which was able to help me broaden my network even better. So this Zoom outreach program has really done wonders for our advocacy and our outreach to people about mental health concerns and the education about the book and about other resources people can use in our support groups.
Yes.
So I say that these different platforms have been great for us.
And teaching.
And
awesome.
being able to spread the word about.
Yes.
Thank you.
Yeah,
And
and the
Michelle-
same for me. I got involved with
Did we
NAMI
freeze?
and with
A little bit.
You cut in and out just a little bit, but you were fine. So at least on my end. Go ahead, Drea.
Am I freezing too?
I don't think so.
Okay. Now I was gonna say the same thing what Dante and Chastity was saying. Yeah, I did reach out to NAMI when I was working at Catholic Charities. That's how I first learned about it. I watched my first In Our Own Voice presentation, and I just literally jumped in head first and was gone. And then I managed to get involved with the Copeland Center and learned about the Wellness Recovery Action Plan, which is the WRAP. And in learning that, I too am an author. I'm an author and a publisher. And I put my pen to paper and started writing books. I started writing mental health books. I started teaching across the country. I started speaking where anyone would listen to me or where I would be there to help eliminate the stigma, and grew a lot of my networking through NAMI and becoming what did Dante say earlier? Train the trainer and a peer leader and wanting to educate and really get out there. Not so much to swell my head, but more, as Denise said earlier, to be humbled by those that you can touch and let them know that, it doesn't matter what walk of life you're in, you can do anything that you put your mind to, that you put your heart to, and walk your road of recovery and be the person you want to be no matter what. So that is how I broaden my network.
Thank you so much. I love that.
You know, NAMI is such a source of nurturing and strength. You know, so I do a lot of advocacy, and I meet people across the state that have the same interests in changing the criminal justice system or changing some of our laws. The people that I've had the greatest connection with are people I've met through NAMI who are also advocates in this way. And there aren't a lot of us, I'll tell you that, but there are a few of us, but there's something to having a connection with somebody who understands your, where you have that shared experience. So while there may be many people who can offer support because they believe in the mission, there's something to be said for somebody who's lived it or has a direct connection. And I have only found that, I find that most strongly with people from NAMI.
Great. Thank you, Denise. So we have a comment, but it kind of relates, or it definitely relates to one of your three things that you're trying to push NAMI National towards. So it says, I would like to see support provided to people who are innocent bystanders and witness traumatic things like accidents. It happens daily, but no support is offered or available at the time other than waiting months for an appointment with a mental health professional. And I know you had spoken about really trying to, broaden our look at trauma-informed care and response.
Yeah, so one of my teachers was Bessel van der Kolk, who wrote the mega bestseller, The Body Keeps the Score. And he would give us lectures in the first floor. Then my beeper would go off and I'd be putting people in restraints on the fourth floor. I would be signing that they were still breathing. And I thought to myself, we are so disconnected between theory and action as a mental health field. NAMI had people like me, psychiatrists, blaming mothers for their children's schizophrenia. And when I first started to talk about trauma at NAMI, people would fold their arms thinking that I was part of the army of psychiatrists who, through misguided mumbo jumbo, had decided that mothers were to blame for schizophrenia. So the reason I wanted to have a trauma chapter was to bring NAMI into the modern era. The Adverse Childhood Experience Study has taught us that people who have trauma experiences have a lot of mental health and physical concerns later in life. We have work to do in that. So that was the reason I specifically wrote a chapter on the impact of trauma, because I want NAMI to get with this program in an active way. I don't want us to be trauma deniers, which I understand was a natural response to version 1.0 blame. But people still describe being blamed in the book. I just want to emphasize that, both by professionals and by their neighbors. So I understand the reticence to talk about trauma. So innocent bystander support, it's a good question. Ken Norton might have thoughts about that. Susan might have thoughts in New Hampshire. Mental health first aid might be one resource for people to consider. But a lot of people witness traumatic things in life. It's absolutely true. And there is not a coordinated support or resource network that I am aware of for that.
So I will add a couple of things there. I think it's a great point. We do have on our website, under the section for gun violence, some resources for folks who have experienced trauma, including mass casualty events such as a mass shooting. We also, on our Connect program website, you can also get to this link through our Survivors of Suicide Loss page on the NAMI New Hampshire website. Information for people who have witnessed a suicide death or found someone after that. The state has, out of the Department of Health and Human Services, a disaster behavioral health response team. We'll make sure we share that link as well. And then I do want to emphasize that New Hampshire's rapid response is available 24/7. 365 days a year. The website is nh988.com. You can chat or you can call or text to 833-710-6477. Don't worry, all that information will be posted. And if you're outside New Hampshire, 988 is a great resource. The only reason we don't recommend it inside New Hampshire is if you don't have a 603 area code, you won't have access to New Hampshire-based services because, and I know NAMI National is working on this, we need geolocation for 988 instead of routing by area code. So keep that New Hampshire rapid response number handy still, but 988 is also a great resource. Great question, and something that we are continuing to work on and expanding on our resources. So I appreciate the question, and we'll get some of that information in the chat.
I
Oh, go ahead.
a lot of what I do is advocating for crisis intervention team training for police officers to have it. But on the flip side of that, I've done some advocating for the mental health support for police officers who experience, who witness these traumatic events, because it takes a toll on them. And, it is also important. It's very important for them to have the support that they need. And within the police force, there has been a little bit of a stigma about seeking mental health support. So to sort of quell that a little bit and make that part of our legislation to have, to ensure people can safely seek out that support and help and not have to deal with any backlash from their, job placement or their community.
Thank you, Denise. So we only have a few minutes left, and I didn't know if each of you panelists would be interested in just, saying a couple more words before we wrap up. And Ken, you as well.
Chaz?
You go first.
I'm trying to give my better half a chance to talk because I talk too much. If you let me talk, I'll talk the whole show. But
We'll keep that in mind for future webinars.
this is not the Dante show. This is the New Hampshire show. So
We actually done on our stories on Associate Press, and it's in actually Yahoo, and in the mental health part of
you're
that.
talking about the New York Post?
Yes, the New York Post
Oh.
also.
Well, she's talking about their story.
Yeah, my
Yeah.
story is on there.
Mental health recovery stories in the New York Post and a few other places that were sent out by the Associated Press.
Yes.
Yeah.
Great, we'll definitely make sure we share those. Thank you.
Definitely.
Denise. Oh, sorry, Dante, did you want to say something? I'm sorry.
Oh no, that's an open check. That's a blank check right there. Let me be on here. I appreciate the energy level here. I appreciate it so much, guys. It's a blessing. And in fact, being able to tell our family and friends about this experience has really helped us to bond closer with people who are truly advocates of mental health recovery. And this is just refreshing, because think about it, guys. If I went back 15 years ago and someone told me that there's going to be this wonderful staff of people at NAMI and they're going to do all they can to promote this recovery process through a book, and this kind of outreach is going to exist, I would have said that's not possible. I said I don't see that happening. But now it's a reality, and now I can say that there's no limit to how NAMI can reach out to people and help people in recovery. There's no excuse now for not getting the kind of support and resources you ever need to move forward. There's no excuse now. The network is there, the presence is there, the energy and the people who love to help people get better and stronger is there. And so keep carrying the torch, Dr. Duckworth. There's other people who want to do that Olympic run with you on the mental health recovery education process. We're there to support you.
And break the stigma.
And break that stigma.
Thank you. Go ahead, Denise.
I just want to say thank you for allowing us to be part of this presentation today and to have the conversation.
Thank you. Drea, is there anything you'd like to add?
I say diddle to everything, it's just, I am so thankful to be a part of the NAMI family. And, it's funny, I always thought, like Ken said, I was going to be a one-hit wonder. I was in the state of California and then in the state of Maryland and just sharing my voice and trying to help and move above and just to be nationwide and being able to not only share my story within this book but within the different classes of the peer-to-peer and some of the other things that I've lent my voice to. I am just so thankful to have this as a platform, not just nationwide but apparently around the world, because we are reaching mighty milestones, and this is not going to end here. My motto is that light at the end of the tunnel is not a train, it's hope. And we need to embrace and love on it just like we embrace and love on ourselves.
And I
Thank
just
you,
want to
Drea.
thank NAMI New Hampshire for having us. I want to thank Denise, Drea, Dante, and Chastity for sharing your lived experience, which is expertise. My final comment would be, this is our book. And if you go to your local bookstore that's not Gibson's and you don't see our book, say, hey, how about our book? And if you like the book, write a nice review on Amazon. If you don't like the book, take a vacation, right? Do not diss our book. It's our book. Like, that is to say, the marketing and communications army is kind of over. Book is selling based on word of mouth and personal advocacy. So that's what I would leave you with. Is, go when you're next time you go to the library, don't make a special trip, but the next time you go to the library to pick up a book, ask them, do they have the NAMI book? And they'll say, what are you talking about? Or they'll say, hey, it's already checked out. You'll say, well, do you need another copy or two? Because it's really our effort to communicate what we're about, what we're doing, and the remarkable people who live with mental health conditions and those who love them. And I just want to say thank you for having us today. You gave us a lot of time, and that was very kind of you. A lot of times, we have to talk in 17 minutes. So this was leisurely that we could get to know some of our panelists and talk a little bit more. So thank you for that as well.
Well, all of us here at NAMI New Hampshire want to thank you, Dr. Duckworth, Denise, Drea, Dante, and Chastity. One of the added bonuses beyond talking about the book is having folks from our broader NAMI Alliance be here. And I am so heartened and reminded that our alliance is strong and it goes far beyond New Hampshire. So thank you for sharing with us today. And truly, thank you so much for this book, You Are Not Alone. We talk a lot about hope, and that surely comes through this book. But I was so struck when I read it about how much love is in this book. And we've talked about that today. So thank you for this love letter to everyone. It truly means the world. And we're really grateful to you for sharing your time today.
Yes, thank you. Thank you, Susan. Thank you for all of our panelists. So on the screen, which of course got moved around for me, we want to continue this conversation on our community boards in Whova, and we will keep an eye on that. For those of you that maybe this is the only session you can do right now, I hope not. I hope you can stay with us. An evaluation will be emailed out tomorrow. And at the end of that is when you would receive the certificate of attendance, if you so need that. A recording of this session will be available in Whova for 30 days and then can be found on the NAMI New Hampshire YouTube channel. If you'd like to support and get a copy of this book at Concord's local independent bookstore, Gibson's, as we've talked about, the QR code is up there on the screen. And then to get the 20% discount, put the code in Not Alone. And we found out that this is good for another week, so we're really excited about that. Coming up next at 11:15, we have the Reverend Carol Moorhead and Dr. Daniel Moorhead presenting Why Can't We Be Friends? A conversation about science and spirituality. And we hope we'll see you all there. So thank you all very much. Again, thank you to Dr. Duckworth and all of our panelists. And we hope you have a great day. I'll see you on another session soon. Tongue twister. Bye-bye.
Bye-bye.
Bye.
Bye, thank you.
Take care, guys.
Take care.
Take care.
Take care.
Good job.
Very good job.